In fact, we've seen clearly in the modeling from Dr. Brown that returning kids and teachers back to school before they're vaccinated will lead to thousands of new cases. The experts couldn't tell us that it wouldn't risk spreading dangerous variants and avoid us from moving to other stages. It won't risk the health of our kids. Well, no one wants kids back in school more than I do. As your premier, these aren't risks I'm willing to take.
After days of reports suggesting he was going to keep schools closed despite the advice of his science advisory table and chief medical officer of health, today Premier Doug Ford cited the latest modeling as the reason he's decided to leave learning online until September.
While some in the science community are applauding the decision, others are worried that the impact on students will only deepen as they continue to learn from home. Joining us now to discuss the issue is infectious diseases specialist from McMaster Children's Hospital, Dr. Martha Fulford, and pediatrician and founder of Kid Crew, Dr. Dina Kulik. Great to have both of you here tonight. Dr. Fulford, we were speaking to you last week when the letter went out from stakeholders from the Premier asking for input. What do you make now of the decision the Premier's made to keep schools closed?
I think no other word for it, utterly horrified. He asked for consensus. Every pediatric organization, every children's hospital, the medical officers of health, the chief medical officer of health, the Ontario Science Table, all unanimously said it was safe to reopen schools. It's a bit disingenuous to say thousands of cases because that's actually not what the modeling really said. It said that there might be an increase of 6 to 10% or 6 to 11%, I should say. And you have to put that in context. Worst case scenario was 11%. We have 700 cases. That's 77 more cases a day. And of those that might be hospitalized, might be 1 or 2 hospitalizations a day, and maybe less with vaccination. So I don't know that I would challenge to ask who's seen those models, but I was horrified.
Yeah, the Ontario Science Advisory Table said that maybe it could be manageable, the number of cases that would come out of opening schools. Dr. Kulik, what did you make of that explanation that the advice he received Friday at 5 p.m. didn't have enough information in it?
I know many groups that provided their feedback, and the feedback overall very strongly was that schools should reopen. We know that kids are not doing well at home. We know that there's huge burdens from a mental health perspective and emotional health perspective for these kids. And their work is to be in school. If we want everyone to be working, kids should be in the school where they're doing their best. And kids are remaining so healthy throughout COVID. They're not getting very sick. The burden for them is emotional and mental health related by being at home for so long.
Dr. Kulik, as a pediatrician, what have you seen from children over the last several months as they've had a remarkably disruptive school year?
Exactly that. Huge burden. Kids are on screens all day. A lot of kids are much less active than usual. We see obesity rates rising. Oppositely like that, we have seen many cases of eating disorders, many kids that are presenting to us in the office and into the emergency room with mental health concerns. Huge burden, lots of sadness, lots of isolation, less activity, too much screen, a whole host of issues for these kids.
And there's a study that came out of Laurier that was presented to the Science Advisory Table back in April. It was published today that shows that disruption could impact these students for years to come. Dr. Fulford, can you speak to that, the concerns that these kids, this generation, they won't be able to make as much money as they could if they were staying in school?
Of course they won't. If we were going to look at total years of life lost over the lifespan of our children, we're going to have more years of life lost because of the interrupted education that will have occurred from COVID, because lack of education, lack of graduation from high school, all of these things are predictors for success in life. And success isn't just economy. This is the health and welfare. The lower the socioeconomic class, the greater the risk of long-term health problems. But also, I couldn't agree more with my colleague, with Dr. Kulik. The physical and the mental issues that are happening today, children are still in developing, they're still forming, and these are going to be lifelong problems. So depression that starts as a teenager, that's going to have an impact for life. If we have children now having increasing overdoses, which we do because we see them in the hospital, this is setting them up for failure for their lives. So absolutely, what we are seeing right now, the crisis we are seeing right now, is going to last for generations.
So, Dr. Fulford, what does this say to you then about the Premier's priorities that schools are staying shut, but likely business may somehow be able to reopen a little sooner?
I am speechless. It is a stain on the soul of Ontario that we have not been able to prioritize our children, that we have somehow decided that the health and well-being and the future of our children is simply not a priority for our province. It is inexplicable, and I cannot express how disappointed I am.
This Laurier study, and we heard from other groups as well, Sick Kids as well, and Kids Help Phone, Dr. Kulik, that kids are going to be impacted by this for so long because they're not going to be able to carry forward or pick up where they left off. How challenging is it at any age to pick up where you left off after 16 months of this?
Very challenging. And the back and the forth and the transition. And, we're thinking about all kids. There are kids that have significant challenges learning from home. There are kids that are being abused at home, that have, food insecurity at home. There are kids that don't have access to stable internet. There are so many kids that are having troubles here, but the most vulnerable kids are the kids that are being left here. They're being left behind, and it's going to create an even greater dichotomy between the haves and the have-nots that will last, much, much farther than, the issues around obesity, for example. This is lifelong for so many kids, the most disadvantaged the most.
Okay, Dr. Fulford and Dr. Kulik, we really appreciate your insight and time tonight here on CP24, and I appreciate you opening our eyes to this. Thank you.